I'm Tracy and this is Chica. I'm going to be doing an assessment on cardiac and respiratory today, and Chica's volunteered to be my patient. She's over the age of 18 years old. We're actually going to perform this in a few different positions. First, what we're going to do with our cardiac assessment is we're going to inspect. We're going to inspect anteriorly, and we're going to inspect posteriorly, and then we're going to inspect laterally on both sides. Okay? Then I'm going to ask Chica to go ahead and lay down in supine position. First, what we're going to do is we're going to identify the precordium, okay, and how we're going to do that is we're going to start at the apex of the heart, and we're going to move mid-sternal and then up to the base of the heart, okay. Next, we're going to locate the apical impulse, which is located at the 5th intercostal space, okay, and this is what we're looking for is we're going to observe the pulsation for point of maximum impulse, okay, and when we're doing that, we're looking to see if we can visually see a lift or a heave. And if we don't, then we're going to actually palpate for a thrill, which would be abnormal. While we're doing that, we don't feel anything abnormal. I have her lean forward on her left lateral recumbent position, and I'm going to feel again because that brings the heart anteriorly so we can feel that better. Okay, thank you, Chica. Everything is normal with that. We don't have anything that's abnormal. Next, what we're going to do is we're going to estimate the heart size. And how we do this is we're going to palpate by, we're going to do this by percussion. And as the sound changes from resonance to dull, that marks the border. Okay, so I'm going to start over here in the mid-axillary, and we're going to go through the intercostal space. I'm going to percuss. And as we're doing this, we're looking at the shape of it. It shouldn't be past the 5th intercostal space. That would show enlargement if it was down. And everything looks normal in this area. Okay, next what we're going to do is we're going to do some auscultation. Okay, I'm going to identify some areas here. We're going to listen with the bell of the stethoscope first. Okay, and we're going to identify the aortic valve. And then move to the pulmonic valve. We're listening for S1 and S2. Down to the Erb's point, which is between the 3rd and 5th intercostal space. The tricuspid. And then the mitral. Okay. Then I'm going to have her actually turn over on her left side. I'm going to do the same thing. I'm going to listen for the aortic at the aortic valve, then at the pulmonic valve area, and then Erb's point, and then we're going to go to the tricuspid and the mitral. Okay. I'll have you sit up, Chica. I'm going to do the same thing, but I'm going to do it with the diaphragm of the stethoscope. Okay. Again, the aortic valve area, the pulmonic, the Erb's point, tricuspid, and the mitral. And as I'm listening to this, everything sounds regular rate and rhythm. I heard the S1 and the S2. Did not hear an S3 or S4, which would be abnormal. Didn't hear any gallops, rubs, or murmurs. If I did hear a murmur, then we would actually go further and look at the timing and duration, the pitch, intensity. They actually grade the murmurs from 1 to 6. Didn't hear any of that. The rate again was regular rate. It was at 80. There was no splitting noted. Okay, and this concludes our cardiac assessment. We're going to move on to the respiratory. So with respiratory, again, we're going to inspect as she's breathing. We're going to look anteriorly and posteriorly. We're looking laterally. Okay, noticing if we see anything out of normal, that she did not use her accessory muscles, that we don't notice any immediate distress right now. We're actually looking to see the shape and the symmetry of everything, and everything looks normal. First, we're going to identify some anatomical landmarks. Okay, we've got the trachea, we've got the substernal notch, we've got the angle of Louis, and then we've also got the costal angle. And have her move forward, and we're actually identifying some vertebra prominence. Okay, and this is a C7, which is the upper, and the T1 is the lower. Don't feel anything abnormal with that. We're actually watching her rate, and her rate is 16, unlabored. We don't notice any difficulty with that. We don't notice any prominence of her ribs. Don't notice any differences in the color, the anterior and posterior diameter. Don't notice any superficial venous patterns. Okay. So as we do that, we're going to move on, and as we're listening, we don't hear any audible sounds like wheezes or stridor. We're also going to look for crepitus. I'm going to palpate here. No crepitus noted. And then we're going to actually do something called the cardiac or thoracic expansion. Okay, so I'm going to actually do this with my fingers, and I'm going to ask her to take in a deep breath and let out. One more more time. In and out. And this looks good and adequate. There's no abnormalities noted with that. Okay, next what we're going to do is we're going to do tactile femmitus, 99. And I'm going to do this by percussion. So when I percuss, I'm going to ask her to say 99. Okay.
99, 99, 99, 99.
I'm going to do it posteriorly as well.
99, 99, 99, 99.
Okay. Everything sounds good there. The vibration is present. You can hear the vibration. Okay, and then next what we're going to do is we're going to actually do something called the measurement of the diaphragmatic excursion. And I'm going to kind of explain to you how we're going to do this. We actually measure the distance in the diaphragm when it's up versus the relaxed position. So what I'm going to do is I'm going to percuss back here posteriorly. And I'm going to ask her taking a deep breath and hold it. And then I'm actually going to percuss. And I'm going to go from a resonant sound till I hear the dull sound. Okay, and then I get there, I'm actually going to mark it. Okay, I'm going to do the same thing on both sides, and then I'm going to, you can relax your breath. Okay,
Thank you.
do the second one. And then what I'm going to do is I'm actually going to ask her to expand all of her air out, and I'm going to percuss from the bottom where it's dull up until it's resonance. Okay, go ahead. Okay, and I'm measuring that point. And hers is actually 3.5, so that means it's within normal limits because it should be between 3 and 6 centimeters. Okay, we didn't. Excuse me. Now we're actually going to auscultate and listen for breath sounds. Okay, we're going to listen for the intensity and the pitch. Okay, and have you take some deep breaths for me. Okay. Do this posteriorly. During auscultation, we didn't hear anything abnormal. What we'd be looking for is any crackles, which is a coarse or fine noise. Kind of sounds like rubbing hair together. We didn't hear any ronchi. We didn't hear any wheezes or friction rub. Everything sounded normal with that. Okay, so the next thing we're going to do is I'm actually going to do a chest measurement. Okay, ask Chica to raise her arms up, measure her chest, and we want to do it around the nipple line, which is usually the midpoint. Okay, and hers is 38, which is within normal range. And this concludes our respiratory assessment.